Now, in its 5th year, the Women of Color Conference has educated women, especially those in the African American community, on the importance of breast cancer screening and early detection. Dr. Kathie-Ann Joseph and her team have educated women on what they can do to reduce their risk, at what age should they start going for a mammogram, and what should they do if they have a history of cancer in their family. With us now to talk about breast cancer and awareness and an upcoming Women of Color Conference is Dr. Kathie-Ann Joseph. Welcome.
Thank you for having me.
So I want to discuss first and foremost breast cancer and its effect on the African American community.
Well, first of all, we all know, or the perception is that breast cancer is a white woman's disease. And in some respects, it's true. The incidence of breast cancer is far greater in white women than it is in African American women. But what most people don't appreciate is that the burden of breast cancer is far greater in the African American community. So even though we've made so much progress, I mean tremendous progress in the treatment for breast cancer, and women are living so much longer and more women are surviving as a whole, for African American women, we're not benefiting from that. So whereas the survival for women as a group is close to 90%, that's not the case for African American women. And so that gap is about 10% less, if not greater.
Have you had an opportunity to evaluate the factors why the incidence of breast cancer is higher in African American women, and I guess the mortality rate is higher in African American women? Is there any studies or is there any additional information?
Yeah, it's the survival rate that's greater, not so much the incidence, and the mortality rate is greater, and it's several factors. It's not just one thing that sort of contributes to that. We used to just say in the beginning that it was the socioeconomic factors, that it's because of poverty and lack of access to care, and that's true. That definitely plays a role. If you are uninsured, if you don't have the money, and all of these things are competing for your time when you have children and so forth, you're not, your health is going to go down the list in terms of priorities. So that's definitely contributing to this problem. But we now have found that there's another component to this problem, and that's biology. That's the tumor biology itself. And so even when you control for socioeconomic status, the other problem is that the biology of tumors in many of these women are just more aggressive. There's something called triple negative cancers. That's something that's becoming, we see that more and more in the news. And it's not just specific to African American women, but more African American women are likely to develop these tumors. And they're just simply more aggressive. And what that means is that when when I'm a surgeon and I operate on a woman and I remove that tumor gets tested for certain receptors. And one is estrogen, one is progesterone, and one is HER2. So those three. And if they're negative for all three, that's called triple negative. And what that means, the significance of that is we can't give them hormonal therapy like tamoxifen or Arimidex, and we can't give them Herceptin. And that's a monoclonal antibody that would block the HER2 receptor. Okay. And so what that means is that all we can do is give that patient chemotherapy. That's it. And that person has, as a group, that group of patients have a far worse survival. And so
these triple negative tumors are difficult to treat, but what about early detection?
Sure. So it's not a lost cause. Early detection will certainly put you at a greater advantage in terms of fighting fighting breast cancer, even the triple negatives. So it doesn't mean just because you have a triple negative breast cancer, you're doomed to mortality and doomed to dying. Early detection certainly will save lives. So I can't stress that enough. You got to get that mammogram. So I tell my patients, go for your mammogram and go for it annually. You can't just say, oh, I got it 5 years ago. You got to go every year.
So with mammograms in the news, there's constant changing information. At this age, you should start getting a mammogram. We've determined that it's this age that you should get a mammogram, or you should only get a mammogram every year, every 2 years, every 5 years. Where are we at right now?
Well, I think that if you talk to most breast surgeons, and definitely the American Cancer Society, the American Society of Breast Surgeons, most the national radiological groups, most will still agree that 40 is the age to start imaging. There was some controversy about whether you should start at 40 or 50, but most breast surgeons, most oncologists will agree, ASCO will agree, start at 40. If you have a family history, you really have to discuss with your doctor what age you should start, because you may have to start earlier. We generally recommend, if you have a family history, you start 10 years, start having a mammogram 10 years prior to the youngest case of breast cancer in your family. So that means that if your mom had or sister had breast cancer at the age of 42, you wouldn't start at 40. You'd probably start at 32. So it shifts a little bit. But for the average woman who doesn't have a significant family history, it's 40.
So how often do you see cases of incidences of breast cancer where there's no family history versus where there is a family history?
Most women don't have a family history. So many women think, oh, I don't have a family history, I'm not going to get breast cancer. Remember, we see it all the time on all the ads on TV. 1 in 8 women, right? 1 in 8 women will get breast cancer. So it's very common, and I'm sure most women know someone, whether it's a friend, a coworker, a family member that has had breast cancer. So you don't have to have a family history. We hear so much now about something called the BRCA mutation, or it's called a genetic mutation that gives you a predisposition to getting breast cancer. I treat a lot of women like that because I have interest in women who are high risk. But that only makes up 10% of all breast cancers. It's a small population. So all women are at risk, all women. And so that's why there's no population that shouldn't get a mammogram. I just say, as long as you're, so I have patients say, well, at what age do I stop? You don't stop. As long as you can get up and lift up that breast and put it on the machine, you go for that mammogram.
So we've discussed this detection and what age should we sign up to get a mammogram, or just push based on our family history. Healthcare system. A lot of people may not get a mammogram because they don't think, I know the insurance companies cover a mammogram, but a lot of people don't have health care, or the health care that they have is lacking, or there are gaps. What can people do if they need to get tested and they need a mammogram? No health care.
Well, I can tell you that in New York City, many of the major hospitals do have programs that will pay for free screening. So what you can do is call your local hospital and find out about the free screening programs. NYU has it, Columbia has it, Mount Sinai has it. All of the major hospitals have it here in New York, and I'm sure Einstein has it too here in the Bronx. You don't have to disclose what your citizenship status is or your social security number. And the nice thing about many of these programs is, if you are unfortunately diagnosed with breast cancer, they will cover your treatment all the way through, whether if you need reconstruction, chemotherapy, radiation therapy, etc. So I would say either call the hospitals, call Susan G. Komen, or call the local American Cancer Society. They can direct you to the right place. And so not having insurance should not deter you, because there's so much funding out there that will cover this. And I treat so many women who come through these programs, and that's what's the nice thing about it, that I don't have to worry about those issues because it's covered. And you can get emergency Medicaid. That's a New York State requirement, that if you are diagnosed with breast cancer, you can be covered under emergency Medicaid for your breast cancer treatment.
That's actually an interesting fact, because I wasn't aware, and I'm sure the viewers at home were not aware of this. So I noticed that there's a Breast Cancer and Women in Color conference coming up on the 24th of September. Can you walk me through this conference? What will be presented, what will be discussed at this conference?
Sure. This is something that is very near and dear to my heart. I started this several years ago with some close colleagues of mine because I was concerned about so many of my patients coming in with locally advanced breast cancer, and I wanted to come up with a different way of reaching out to my patients and to other women to educate them about breast cancer. And it's become such a wonderful event that we can educate women, and it's also a fun day. This is being held September 24th in Midtown Manhattan at Club 101. It's not a disco, it's actually a very nice venue. It's 101 Park Avenue and East 40th Street. It's free of charge, 8:30 to 1 o'clock, and we're going to have a lot of physicians and healthcare providers as well as survivors who will talk about their experiences, and we have a lot of information to provide.
Will there be an opportunity to be screened or have a mammogram?
No, not at that time, but we will definitely provide information as to where you can go for screening.
So this might be a great resource, as we discussed, with finding your local hospital.
Yes.
And finding the various avenues that you need to take to either prevention, detection, and treatment.
Absolutely. This is the place to come to get all that information.
Okay, so if people want more information on this, what website should they visit?
They can visit the NYU Cancer Institute website, and they can actually register there. It's free, but we do ask if you can to register. It's www.nyuci.org/RSVP.
Okay, and is there a phone number that they can reach out to you at, or is it best just to visit the website?
You can visit the website, yes.
Perfect. Thank you, doctor.
Thank you so much.
Thank you. Don't go anywhere, because there's more right after this.